Thank you so much. You guys are on. Take care.
Thank you. At 5 o'clock, I will call the meeting, what date is today? The July 7th meeting of the Quality of Life Committee to order. And if we can get a roll call for attendance, Jennifer?
Sure. Councillor Jamie Cassett.
Here.
Councillor Michael Garcia.
Present.
Councillor Chris Rivera.
Here.
Councilwoman Renee Villarreal.
Present.
And Chair Carol Romero Worth.
I am here. With that, we go to approval of the agenda. Are there changes to the agenda from staff?
None from staff tonight.
Okay. Changes from the committee? If not, is there a motion to approve?
Move to approve.
Second.
A motion to approve from Councillor Cassett, a second from Councillor Rivera to approve the agenda. If we could get another roll call, please.
Councillor Michael Garcia.
Yes.
Councillor Chris Rivera.
Yes.
Councilwoman Renee Villarreal.
Yes.
Councillor Jamie Cassett.
Yes.
And Chair Carol Romero Worth.
Yes. All right, now we move to approval of the consent agenda. Are there changes to the consent agenda from staff?
None from staff, Madam Chair.
All right, are there items that the committee would like to hear this evening?
Madam Chair,
Yes, Councillor Garcia.
for some reason, my PrimeGov is acting slow, and I believe it's item A. Is that the chart process RFP?
Yes, all right. We'll pull item A. Is there anything else the committee would like to hear tonight? Is there a motion to approve as amended?
To approve as amended.
Second.
All right, we have a motion to approve the consent agenda as amended. And if we could take a roll call again.
Sorry, Madam Chair, can you say who got that second?
Yeah, I think it was Councillor Rivera and made the second, and Councillor Cassett made the motion.
Got it. Okay, Councillor Chris Rivera.
Yes.
Councilwoman Renee Villarreal.
Yes.
Councillor Jamie Cassett.
Yes.
And Chair Carol Romero Worth.
Yes.
I'm sorry, did I miss Councillor Garcia?
Yes.
I think I missed you. I apologize. Councillor Garcia.
Yes.
Thank you.
Okay, approval of the minutes, June 16th, 2021, Quality of Life Committee. Are there changes to the minutes from staff?
None from staff.
Any from the committee? Is there a motion?
Move to approve. Second.
We have a motion from Councilwoman Villarreal to approve the minutes. We have a second from Councillor Cassett. If we could take a vote on the approval of the June 16th minutes.
Councilwoman Renee Villarreal.
Yes.
Councillor Jamie Cassett.
Yes.
Councillor Michael Garcia.
Yes.
Councillor Chris Rivera.
Yes.
And Chair Carol Romero Worth.
Yes. All right, we have two presentations tonight. The first one is about behavioral health at the city and county, and we have Director Ochoa with us to make that presentation. Welcome and thank you for being here.
Thank you, Madam Chair, members of the Quality of Life Committee. I'm happy to be here to present with this topic tonight with Rachel O'Connor, who's the Director of the Community Services Department for the county. And because the county has been sort of planning and mobilizing around behavioral health now for the last, I would say, 5 years or more, I'd like Rachel to begin and follow her presentation.
Thank you, Kira. Madam Chair, fellow counselors, Rachel O'Connor from the Community Services Department, thank you so much for having us here today. And I'm going to start by attempting to share my screen and talk with you a little bit, let's see, about what's happening at the county with regard to behavioral health, some of the groundwork that we laid in some of our current projects. Are you all able to see that presentation? Okay, thank you. So I'm going to start by talking about the La Sala Center because it's really prominent in my mind right now.
Can I
It
interrupt
is-
a minute?
I'm sorry, we have a question. Yes,
Sure.
Councilwoman
Sorry to interrupt.
Villarreal.
Can you make it a full screen for us instead of seeing the panels on the side? If you could do the,
If you hit the slideshow tab, Rachel, at the top, on the far left of your screen, yeah. And then you say from the beginning, or from current slide.
Okay, is that better for everybody?
Except we're seeing your notes or your,
Sorry, I'm
Jennifer.
accustomed to working off WebEx.
maybe
Maybe-
display settings.
Yeah, I was just about to say that.
Nope. There you go.
There you go.
Thank you.
Okay, now if I can just figure out how to get what from one slide to the next, I'll be in good shape. So thank you very much for sticking with me through that awkward moment. I want to talk a little bit about the history of behavioral health in Santa Fe County because we really started in 2014. And we partnered with Christus St. Vincent to develop a needs assessment. And the needs assessment was for Santa Fe County. And what we looked at is through a whole process of interviewing people and professionals and organizations across the county, what is it that we really need? And the response to that was overwhelmingly, we are looking at the need, an overwhelming need really at that time for behavioral health services. And if all of you can think back to 2011, 2012, 2013, what we were seeing in our community was a really significant onset of issues related to behavioral health that were brought on or much more prominent because of the opiate overdose issues that we were experiencing at that time and continue to experience in the state and in Santa Fe County. Based on the outcome of that, we developed a health action plan. And that health action plan prioritized for us how Santa Fe County was going to spend money related to health services. And that really was a tremendous time of growth between 2014 and 2016, because there were massive changes at the state level with regard to how counties spent indigent funds. And with that reform, the county went from being an entity that paid bills to being an entity that could plan towards addressing specific health indicators. And in this case, those health indicators were reducing drug abuse in Santa Fe County, reducing alcohol misuse, and providing greater access to healthcare, largely healthcare related to behavioral health. So in 2016, the county held a behavioral health summit to look at what was necessary to do that. And we started by funding a mobile crisis team. And Santa Fe County actually funded mobile crisis starting in, I believe, 2016 with a contract with Presbyterian Medical Services for the development and operation of a mobile crisis team that could work hand in hand with law enforcement in addressing behavioral health issues. Out of the Behavioral Health Summit came a request from the community to fund a crisis center. And the county acted quite quickly after that. In 2016, the voters approved a capital bond, and in 2017, the Board of County Commissioners approved a 1/8 GRT with funds to operate a crisis center. So relatively quickly after the summit, we devoted about $2.5 million towards construction for a crisis center, and about 1.6 million a year for operation of that center. We immediately released a request for proposals for a 2-phase project. One is development and planning, which for us lasted several years, of a crisis center. And the second was full operation. And I'm happy to say that at the end of July, we will be kicking off the La Sala Center. So the La Sala Center really is a hybrid living room crisis center. It includes a detox service that's provided by Santa Fe Recovery Center that occupies half the building. It doubles Santa Fe County's capacity to treat people with detox services. It also, thanks to the Recovery Center, Christus St. Vincent, and Santa Fe County, as well as Ancorum St. Vincent, allows Santa Fe Recovery Center to move from providing detox services through a social model to doing medically managed detox. So it's a significant boost up in our capacity. That half or that phase of the crisis center opened a week ago. We will be opening the end of July, the second half, which is the living room model. It's a hybrid crisis service center. It's called La Sala. It provides essentially a number of support services to de-escalate a situation where somebody is experiencing a behavioral health crisis. And they do that through certain de-escalation interventions. We also are going to be providing things like pharmacy. So if we have somebody who is no longer operating well because they are off their medication, we can address that issue. We offer counseling. There will be peer support. There is a specific law enforcement entrance so that we can work productively with law enforcement, as well as the hospital, to try to reduce the number of people that are coming in to our ERs and to our jail system, with hopes that we can stabilize people in a significant way. I want to say that the center is not 24/7. It has 24/7 capacity. So the center is going to be opening its first phase, where we're hoping to run from 10 in the morning until midnight, 6 days a week. If we have people who come in off hours, we will be able to address that through mobile crisis, and people can be brought to the center on the off hours in order to stabilize. So that program is really one of the biggest things we're doing in Santa Fe County, but not the only thing. After we started getting funding for the crisis center, we also did a gap analysis that was completed by Pam Hyde, who's the former director of SAMHSA. And we started to fund other programs and continue to find creative ways to fund other programs. So I wanted to just present briefly on some of the other things that we are doing in behavioral health. So substance use disorders, we are looking at, we provide funding for residential and outpatient treatment through the Santa Fe Recovery Center. We're the only provider or the only entity that funds residential services. But we still continue to believe that there is a certain segment that do better on a residential basis. We provide about $300,000 per year for detoxification services at the Santa Fe Recovery Center, now located at La Sala. We also provide additional funding to them in terms of in-kind services for residential and outpatient treatment. Santa Fe County has just been funded to start a LEAD program of our own. We're looking forward to working with the city on law enforcement assisted diversion activities that occur in rural parts of Santa Fe County. And we all are doing that in partnership with what's called our COOP program, which is an overdose prevention. We also have a team that works out of the fire department and the community services department to do follow-up on people that have experienced a drug overdose. They'll be working hand in hand with our LEAD team. Other things that we fund in terms of specific substance abuse disorders, we fund medication-assisted treatment at La Familia. Although it's not on the slide, we fund harm reduction. We've also funded jail reentry out at the jail in terms of people that are specifically tasked with trying to reintegrate, particularly people with significant behavioral health issues, back into the community. The next slide, I'm not going to belabor too much because I know that Director Ochoa will go over the Connect program. But the two big programs that we've really rolled out in the past 3 years would be the La Sala Center and the Connect program. The county started this funding really based on observations and input from Kira. We invested in setting up a navigation system based on the gap analysis. We feel that we're providing high levels of service for people that are in need of help relative to the social determinants of health. We're hoping to put some of the ARP funding, of course, into this Connect program. It's been such a great tool for members of our community to access services. So just starting this fiscal year, which started just this week, we started a youth services division at the community services department at the county. We just hired our first director, Chanel Delgado. And we did this really because of a real interest coming from the commissioners in youth-related services. And it started out as recreational services when I first came to the county. It has morphed into services that impact those areas of the health action plan that I talked about earlier. So we fund all kinds of prevention. We fund youth behavioral health. We expect to significantly expand the dollars in this program in this fiscal year in helping youth transition back into school and addressing some of the issues that we're seeing that are predominant in the youth community. And to expand, Santa Fe County was really pleased to help team builders get up and running. We expect to be releasing more RFPs this year to expand, what is an incredible gap in access to services, to behavioral health services for teens. And then I just want to talk briefly about some of the things that I see coming in the future. We just released a NAMI contract, NAMI Santa Fe, for those of you who aren't familiar, the National Alliance of Mental Illness, and working with them in partnership to put them into our Connect program so that we can better serve people who reach out to NAMI. We have a leadership team that the county created in order to try to align better services for people and families, frankly, who need support in behavioral health. we're looking at doing some kind of pilot and peer support because the most recent research tells us that peers are often more effective at addressing behavioral health issues. And of course, the expansion of youth behavioral health funding is upcoming. And I just want to close with one thought, and that is, we established a behavioral health leadership team about a year before the COVID pandemic hit. And the priorities that we set prior to the pandemic were really around systems coordination, and the establishment of things like step down services for people coming out of the hospital. But we have a whole new wave of challenges that have come out relative to COVID and the outcomes of COVID. Some of the things that we're facing now is we've started a lot of new programs, both the city and the county, and trying to coordinate and align those programs like the teams that Kira's going to talk about in coordination with our mobile crisis team. And I'm pleased to say that's working quite nicely. Coordination of the Thrive program with our team in terms of lead programs. We had a lot of new services we've kicked off in the past year and a half. And I think our challenge now is to make sure that those teams are working together as efficiently as they can in stabilizing folks and hopefully bringing us to a place that supports better behavioral health overall for people that are in crisis. The last thing, and then I promise to quit talking, is that, oh gosh, it just skipped out my mind. But oh yes, we're seeing significant workforce challenges, more so than ever. In terms of, for example, we need to hire nurses for the La Sala Center. We're a little bit panicked with our primary partner with New Mexico Solutions of exactly how we're going to do that. I had a friend who tried to get services for her daughter who was experiencing a behavioral health crisis. She called 35 counselors and was unable to get her daughter into service. So some of these access issues have really been exacerbated by COVID. And I think we're starting kind of with a clean slate of tremendous resource capacity here, but getting it up and running and making sure that we're working together is a priority. I know that's a lot in a short amount of time, but thank you very much for hearing me out.
Thank you. And thank you, Rachel O'Connor, for being here. I didn't mean to not announce that you were part of the presentation team. I think I was relying too heavily on the agenda, so my apologies.
No problem. Thank you.
If you would stop sharing your screen, and then, I don't know, Director Ochoa, did you have more you
Chair,
want to add here?
Thank you. I would. I think we sort of have a 1-2 punch, as it were. So if I can go on, and then maybe we can both stand for questions.
That'd be great.
So I'll share my screen. Can everybody see that okay?
Not yet.
Oh, okay. Oh, I see why. Okay. Don't look at my messy desktop, but here we go. So in terms of our behavioral health initiatives at the city, for a long time, the Community Services Department also under the previous director, and really the incredible work that Youth and Family Services Director Julie Sanchez has done to incorporate results-based accountability into the contracts that come out of the Children Youth Commission and the Human Services Committee. The strategic plans in both of those commission and that committee have long identified behavioral health as a primary issue that Santa Fe, the city of Santa Fe, needs to address, whether it's youth, substance use, disorder or suicide or adult behavioral health needs. As Rachel said, all of the data and all of the needs assessment point heavily to this as an area that we've needed to invest in and have invested in at the city. Right now, with the creation of the Community Health and Safety Department, I thought I'd just give an overview of under our department and in partnership with some others, what's going on in the realm of behavioral health. So obviously under fire and police, we've got a number of initiatives that you're aware of. We have our crisis intervention training. In 2018, the Santa Fe Police Department invested heavily in ensuring that the entire workforce received intensive crisis intervention training in de-escalation and trauma-informed response. And this year, the fire department, myself included, will be undergoing a 3-day training around the same training that the police department has engaged in, tailored to fire. So that means that our entire public safety workforce is trained in handling behavioral health in the field. And we also, as you know, have our mobile integrated health office, which began doing work with high utilizers and has morphed into being primarily an opiate outreach team, similar to one that Rachel referred to at the county, COOP, that follows up with folks that have had an opiate overdose and counsels both them and their families in terms of future overdose prevention and harm reduction, naloxone distribution and case management. Just today, the municipal court asked where they could get naloxone, and Miho was on the scene immediately giving naloxone and preparing to give training. But they also, as you know, continue to informally do some outreach to folks in crisis and in the field who are unsheltered, although that's not their primary focus. Of course, this year we've launched finally our alternative response unit. I shouldn't say finally, because it was relatively quick in getting going, if you think about it. But that team has a case manager, a paramedic, and a police officer, sometimes, but not always, a police officer responding to behavioral health calls for service. That is ramping up here in the new fiscal year. We'll add a new team. And by the fall, we expect to be able to add a third team to be out 5 days a week in the peak hours, which in the behavioral health world are often actually about 10 to 8 p.m., 10 to 6 p.m. We also have our Thrive program, which is our lead program, which started many years back, where the Miho folks are also providing case management to clients that PD diverts to them for nonviolent crimes that were driven by unmet behavioral health needs. And then finally, we have our contract with Solace Crisis Treatment Center for domestic violence and sexual assault coordinators who provide care to victims and assist the special victims unit. So really our public safety departments, fire and police, have a solid footing in behavioral health interventions that we can build upon. In community services, Rachel mentioned Connect. All of the contracts that we now have, almost all of the contracts coming out of Human Services and the Children and Youth Commission are really considered Connect contracts. They fund both navigation and at sometimes direct services. So some of the ones that I've pulled out here and to highlight are the ones, all of them are doing navigation, which means assessing for social needs, housing, food, transportation needs. By the way, one of the evaluation measures in Connect is, did that individual, did we save them from going to the emergency room? Did we prevent them from going to jail? And so we measure that. And that is a goal of the Connect program overall. And we are seeing some interesting development, data coming out around the prevention of acute crises for this population being served in Connect. Anyhow, the direct services that are provided through Connect for us at the city and the adult world are done at St. Elizabeth's Shelter, where on-site counseling service are coupled with navigation. At LifeLink, on-site navigation really includes behavioral health intervention in the same breath, if you will. In the youth world, we've invested heavily in behavioral health for a long time. Our programs at Gerard's House Grief Services for Children, at the Sky Center, New Mexico Suicide Intervention, Parent Involvement Program, which is a CYFD and CYC funded program for youth and parenting groups, youth shelters and family services where homeless youth get support services that include counseling. At Casa Esperanza, children and youth in the shelter receive bilingual counseling through city-funded contracts. And in coordination with the county, these are not contracts yet, but will be, we're working with them on their Team Builders project, and we're doing that in coordination with the Santa Fe Public Schools, which is bringing back a much needed behavioral health resource for youth in the community. So thanks to the county for their leadership on that as well. In terms of restorative justice, we're looking at expanding some of those programs using both Children Youth Commission and some CYFD funds that we have this year, and that'll be by RFP. Over 3 years from now into the next 3 years of these contracts, we're seeing that we're investing at the city about 1.8 million in the course of 3 years in behavioral health services to adults and youth in the community services department. We also are looking at homeless response, which very much goes hand in hand with people that are suffering from behavioral health issues. We obviously fund emergency shelter services at Interfaith and Navigation. Our Built for Zero project is, we have a small contract with the New Mexico Coalition to End Homelessness to boost their capacity to really get that data that we need to make some of these decisions about what kind of housing is needed for folks who are unhoused. Is it permanent supportive housing? What kind of intensity of counseling do these folks need? Do they need detox services, treatment services? So happy to be able to announce that the RFP for mobile hygiene unit and street outreach is posted at the city right now. So to all of those listening who want to get out on our vehicle and our mobile hygiene shower and bathroom unit that we purchased with CARES Fund and do some incredible work in our community, reaching unsheltered people with an array of services and including going out, the team will go out into arroyos and parks to meet with folks that are out there to try to get them connected with services. We invite you to apply. Domestic violence gap analysis and plan. I think that's sort of coupled with what we've done in police and fire. We want to look at where are the gaps in services for folks experiencing domestic violence. We know, for example, that it's great, the counseling services that people can receive when they're sheltered at Esperanza, but there really is a gap for people who aren't at Esperanza, for both adults, women primarily, and their children, because of a lack of, as Rachel mentioned, workforce. And this is a very specialized kind of counseling that people need to receive, as well as the fact that it's not always possible to pay for these services with insurance, with Medicaid and other insurance because of privacy issues. We are seeing also that it's really important that we're coordinating closely with the Affordable Housing Department at the city in terms of our work with Consuela's Place, the Midtown shelter, and what's going on there. Community Services is not funding any services there, Affordable Housing is, but Anna Kale is essentially the contract manager for Consuela's Place with her expertise on emergency shelter. And so that's been a useful collaboration. Then we want to call out Ancorum St. Vincent and the partnership that we're engaging in with them around housing. They have something called the SB3 initiative, which is essentially looking at permanent supportive housing for people with behavioral health needs. The hospital and the county and the city obviously have a vested interest in ensuring that people with behavioral health disorders are not showing up in the jails and flooding the emergency room, which they currently are. And what other alternatives do they need besides the crisis center, which is going to be a huge benefit to the community? They also need places to live and places where they can get the supports they need in their housing. And then, of course, we're looking at our encampment situation, which is extremely up right now. And the Community Services Department is currently engaged in coordinating with other city departments a citywide encampment response. This is in the homeless response realm, a total investment of over 1.4 million over the next 3 years. If not more, if we can get more in, we will put more in. And then finally, I would be remiss if I didn't mention the direct services that we provide in community services and in recreation, which in many ways fall on the continuum of in the bucket of prevention. Libraries, I have to call out because we don't have day drop-in centers in Santa Fe right now. It's an acute need for people with behavioral health issues, as well as unsheltered people. And the libraries are essentially functioning that way, or have been. We've seen an increase in people on streets during the day because the libraries are closed. I'm not suggesting that the library should serve this purpose always. I think we do need other services, but the fact is they do. And our librarians who staffed the Midtown shelter during the pandemic are very good in working with populations that have behavioral health needs. Our senior programs, one of the largest areas of need in the realm of behavioral health is people who are senior citizens, increasingly experiencing dementia, Alzheimer's, and other mental issues that are sometimes involve isolation, and programs that serve this population can be very preventive in terms of reducing isolation, providing, in some cases, the only kind of check-in that these folks will have in their homes when they get Meals on Wheels delivered, socialization in the form of programs and congregate meals, our homemaker and respite programs, which allow people to stay in their homes and live independently as long as they can, provide support to very stressed family members. And then our retired senior volunteer program, in which an incredible workforce of seniors who still want to give back to their communities, some of whom are low income, will go into programs like, our youth behavioral health services programs in the schools, or Pete's Place or St. E's, and give their time to make sure that some of these needs are met. I also want to call out our youth summer and after school programs. I'm very excited, as you know, that those are now housed under recreation. I'll give you an example of how successful I think these are. It's a little bit sensitive, but earlier in it sometimes happens that these programs can really turn kids around when they're in a period of maybe experimenting with things they shouldn't experiment with. We just had a collaboration between the summer program and the police department, where some of the youth were caught drinking beer, and we had the police come out and give them a talking to. And that's an example of hopefully an early intervention that can prevent some of these long-term issues that we're seeing require heavy investment down the line. So that's a quick overview of the things that community health and safety is doing in regards to behavioral health. And with that, I think I'll stop sharing, and Rachel and I can stand for your questions.
Terrific, thank you. And thank you for those 10,000-foot presentations about a wide range of work that's being done both at the city and the county. Very interesting. Do we have questions for either presenter from the committee? Councilwoman Villarreal.
Can you see my hand?
I can't, well, sort of, but I am also now trained to look for it.
Awesome, thank you. Thank you, Director O'Connor, for presenting about what's happening in the county. I used to work for the county, so it's great to see how things are progressing and how things are shifting now that La Sala Center will be open. I think it's going to be a busy place. There's a lot of needs, and that's pretty much one of the few remaining, or one place I feel like actually will have service versus other service providers that have come and gone in the region, in our county. So I'm excited to hear about that. I know the mobile crisis unit, its first iteration was highly successful. There was a lot of interaction with the public that were experiencing crisis. And then there was a shift in who led that. And so there was some, I don't know, the iteration of like what happened. And ultimately there was a period of time where it didn't run smoothly. So I'm excited to hear about it, that it's part of the overall center support. And I'm curious if there's how it could possibly intersect with some of the support we need in the city, and if there's some kind of plan for or intersection or partnership with city, or what will that look like? Because I think we are in serious need of that just for the city. And so I know the county's huge. People don't understand that it takes an hour to go south in the county. It's a big county. So how do you see that partnership or relationship developing?
So, Madam Chair, Counselor, that's an excellent question. In fact, we just had that on our agenda for the leadership team. The majority of our calls come from the city, as you know, because it's the most populous area. And the mobile crisis team that New Mexico Solutions is now running is responding to a lot of city calls. Now we're in wave 1 of this pandemic, and both Kira and I have had some conversations around that. But the alternative response unit is calling in mobile crisis on cases where there's someone with a significant behavioral health issue. And both teams have felt that that partnership is working incredibly well. And so we feel that the opportunity to partner is being established right now, is going smoothly, and will continue to go smoothly. I think the one thing that I would ask for is some patience in our ability to get up and running. We are now responding on site to certain constituencies, including the city alternative response unit. And for example, people that come in through NAMI or people come in from law enforcement. And as soon as the crisis center opens up, we'll be starting phase 2 of that opening. And by September, we expect to have the full array of services running. But we definitely, both Kira and I think, recognize the need for partnership in that area and are committed, as well as the teams from New Mexico Solution and from the city are committed as well.
Yes, I see that connection going to be very important. And maybe later on we can have a presentation about how that's going, how the communication works. I'm always curious, like how things get passed down and how ARU gets activated. And I know dispatch has a role, but there's still this piece that I think I'm not quite clear understanding how it's fluid or how it's efficient. So that will be my interest in the future, how the Mobile Crisis Center interacts with ARU and dispatch. And then also MIHO and our other programs. And I'm glad to hear that you all are starting a LEAD program, and hopefully some of the I would call them missteps or missed opportunities for us for LEAD when we started it, just to have those learning moments that will help you all develop
Thank
it.
you.
Yeah, I think that would be great to make that connection. And also just making sure that law enforcement is in that process. Our LEAD program used to be in the police department. Now it's under the umbrella of fire. And so I'm still of the mindset that police really need to be part of that process of LEAD and making recommendations or doing that intervention piece. So I'm curious how you all see that as for the county sheriffs and their role in your, what did you call it? Are you calling it Thrive, or what do you call it?
Madam Chair, it's actually under the COSAP program, So we're still referring to it as COSAP just to generally differentiate for it. We just hired for that program. And thank you for your comments. I would love to come back in, 4 months or 3 months and present as to where things are at. And I think Kira and I could spend some time specifically on where we overlap and the status of the La Sala program as well.
Yeah, that would be great. And also just to understand how you are setting up your lead
Sure.
program. And I think you said that it was also going to be under the fire department, or is it under your sheriff's department?
Madam Chair, Counselor, the lead program is under the Community Services Department, but it's joint between the fire department, the sheriff's department, and the Community Services Department. So we house it here, but all those players are, all those entities are players in the lead program.
Got it. Okay, thank you for that. And then the other question I had was when you were describing the La Sala Center, and you said that there was a law enforcement entrance. So that's a separate entrance, right? That's not the main entrance. Can you
Madam Chair,
explain that a little
Counselor,
more?
it is. So it's a separate entrance for law enforcement because there needs to be an assessment done on the front end before that person is introduced to the living room to make sure it's an appropriate level of care. And along with that, I should say that the La Sala Center is an intermediate level of care. We think of it as urgent care for behavioral health. It is not although we expect to divert people from the hospital, it is not a hospital alternative. People that are highly suicidal or highly violent will still be going to the hospital. But we do hope to prevent people, and I call it on the way up. So most of us at some point in time have experienced crisis. Crisis can feed on crisis if it's not stopped. And our hope is to stop it at an earlier stage before people end up in the hospital or in the detention center.
Right, that makes sense. And so you're saying there is another entrance for folks that are experiencing crisis. They don't have to go through a law enforcement, or does everybody have to go through a law enforcement assessment?
Madam Chair, Counselor, so there are two entrances. One is the main entrance. And when you enter the main entrance at La Sala, you can go to the right, which takes you to the detox center, or to the left, which is into the living room. Some people, as they're coming in, won't be ready for the living room. And they will come in through a secure entrance and be assessed, but everyone will be assessed. It's just a matter of how they enter the building and a safety concern that there is a separate entrance for law enforcement.
Good to know. Thanks for the clarification. And Director Cho, I just want to thank you when you were describing just what we've been doing in the bucket of behavioral health, and that we actually have programs, whether it's through partnership or that we are starting from the ground up and leading ourselves through the city. I think it's important to say that when I first started, we didn't have any of this.
Right.
I mean, we had these programs, they were kind of dispersed, but I feel like they're being more integrated. And I appreciate your experience with the county, because that actually connects us in a better way that makes more sense to me than trying to say that city and county do not intersect or interact, and that's a farce. So I think it's important that you have that experience so that you can bring it to our world and make those connections. So I appreciate what you've been doing, and happy that we can say we have behavioral health services versus saying, well, we provide services, but it's not necessarily connected to the county. So that's all I have. Thank you.
Thank you. Other questions or comments from the committee? All right, doesn't look that way. Thank you. And I have to say, I agree with Councilwoman Villarreal about all the work that's gone in on the city side to really integrate, make these things work, and the collaboration with the county, I think is fabulous. And so thank you for your work. And I think the community will be better served as a result of this collaboration, and, you know, the city really becoming a partner in a serious way. So thank you.
Thank you.
All right, our next presentation, we may not have the presenter who was going to beam in remotely and may not be here. Jennifer, do we have our presenter?
I don't see her name here unless she's under a different name on her Zoom account, but I don't believe she's
Okay.
here.
So we are looking for Sylvia Barella. Sylvia, if you can hear us.
And yeah, she did say
Otherwise-
she was traveling, so I'm wondering if she just got caught up.
Yeah, it may be that she's just having a connection issue. So since we don't have her, we will move on to our consent agenda. If she is able to join us, we will loop back around.
My name is Dr. Paul King Miller. I'm the clinical director at Santa Fe Recovery Center, and Sylvia asked me to be here on her behalf.
Oh, perfect. Okay. Thank you. All right. So we have Paul King Miller here, and you'll do the Santa Fe Recovery Center presentation. Thank you. Thank you for being here. I did not know that you would be doing that. Sorry about that.
Not a problem. It was a very last minute thing, so I don't have a fancy slideshow for you guys. But
No worries. No worries.
thank you for having us here. I guess I'll kind of tie in with the presentation that was just given and say we're partnering there at La Sala. We're running the detox half of that for the medical detoxification. And sort of the idea or model around Santa Fe Recovery Center generally is we're trying to develop a continuum of care for all the people that we come into contact with. So starting with day one, going to a detox, or even getting a crisis call and being brought in and assessed and brought to detox, that will funnel directly into our residential programs. And so we have a 30-day residential program for men and a 30-day residential program for women. And we have 20 beds at both facilities for that. And then there's a 90-day extended care. So it's not 90 more days, it's 90 total. And that's both for men and women. And we also, in the women's program, there's a women and children's program. So we will accept women with their children, or if they're pregnant. We have medical care for those instances, and a specialized sort of set of treatment objectives when women come with their children. In those programs, there's a tremendous amount of case management that goes on. People often come and they don't have IDs or social security cards or any kind, like they lack most things. And so we do a lot of case management early on to get those just kind of the fundamental pieces of life together. If there is family involvement or supports, we start to bring them into the picture as quickly as possible. In the first 30 days, it's really kind of a lot of stabilization, working on skill building, sort of how do you cope with the triggers in your environment that could lead to relapse. We encourage extended care in those instances where it makes sense. And if not, we help with the transition back home or wherever this person is going to next, and make referrals where we need to. In the extended care, it's people have an opportunity to go get a job. They're still working and developing their support networks and support groups, connecting with family again, if that's part of their treatment. And then again, case management all the way through, linking people with the next step of what they're going to be doing. For those folks who they were speaking about people who were unsheltered or otherwise didn't have resources, we have sober living option after the 90-day. And there's the apartments at the Midtown campus, the old college of Santa Fe. There's the apartment buildings there where we can house up to 40 people to an apartment. And that's meant to be a sort of a stable ground where a person can start to do things together. I think one of the struggles we saw early on was we do, 30-day, 90-day, but then you have somebody who's sober and they don't have a place to live. So they're now living out of their car. And that's a pretty quick route to relapse or right back to square one. So we're trying to give as much support as we can, as long as we can, and actively try to bring in the natural supports as quickly as we can, and find the right balance there. I don't know what else to say. I mean, I could say more about our clinical programming and sort of some of the things we're trying to address along the way. But ultimately, our goal is to help a person learn the skills that they're going to need to sort of manage things, get them the tools and the supports in place to help them manage things, and keep them in the system no longer than they need to be, but as long as they need to be, right? We're always moving toward them stepping out on their own, and also realizing some people can do that in 30 days and make a go of it. Other people need much more time. One element of our program that it's been around and it does good work is our outpatient program, but Santa Fe Recovery Center started as a residential treatment, and we've always kind of thought of ourselves as that way. But given the circumstances in the state and whatnot, the ability to have the greater outreach through outpatient services, both for the clients that we have, so we can stay connected in supporting them if they go, if they don't need residential anymore, but they want to stay connected in some way, or if they go to Las Cruces or wherever they may be from, we can maintain that connection and provide them support therapeutically that way. So as people come out of our residential, that system is there. But we can also reach people hopefully at a lower level where they're needing a lower level of care. We may be able to provide therapeutic or intensive outpatient therapy before they get to the place of needing to be picked up and brought to detox and treatment. So trying to kind of approach it from both ends. And our outpatient program has been doing that, but a big goal of mine and the organization over the next year is to really strengthen our outpatient program. Maybe make it a more focal point of what we're doing, and the residential work is maybe a little more background. Because I think if we're doing outpatient correctly and well, that will be a bigger part of what we're doing than the residential treatment. Yeah, and I guess I noted the challenges that were brought up in the previous thing, and I think the major challenge that we have also is workforce. There's just a real shortage, and coming out of COVID, surprisingly, everything seems way more difficult to come out of it than it was to go into it. Just getting back to AA meetings or having people come in to do exercise things with our clients or yoga, getting those things going again is logistically a challenge. And then the staffing part of that is a challenge as well. We're just not getting the size of our organization and the number of people that we're serving, getting qualified and able people to fill those positions that we need filled is challenging.
Thank you.
Yeah.
Yeah, thank you for those thoughts, and no fancy PowerPoint necessary. That was great overview of what your world looks like. So I appreciate it. Are there questions from the committee? Councilwoman Villarreal.
Thank you, Madam Chair. Just a quick question. Thank you, Paul, for joining us and for your information. I was trying to remember, we're happy to have you on the Midtown campus. I think that's important. I know it's been a temporary location, and so I was trying to remember, you all aren't you building a new residential facility? Can you tell us a little bit more about where that's at?
Yes, we're currently in contract with a place, I believe it's Warner Road, just toward the Lottaburger out in St. Mike's, down by the pet boarding place there. And it was an old gym or something, but we put a bid in on that, and we have some person doing some looking at how we can transform that into residential. But that's unfortunately only going to house our 30-day men's program. I think our intention is to maintain the apartments at the Midtown campus going forward. We don't have a plan for that. I know Sylvia, the executive director, has wanted or desired to be there because they're kind of ideal, frankly. They're centrally located to a bunch of things. It provides sort of a perfect contained space for people to have a nice environment and home to live in, and also easy for us to sort of support and monitor and do things there. So that's kind of our plan. We're moving the 30-day out of the dorm rooms to a building, and the plan is to maintain the extended care and sober living at the apartments.
Okay. For some reason, I thought there was a plan that you all were constructing a new facility. And I can't remember what part of town. Am I wrong about that? I thought there was some...
there's going to be some construction at the Lucia Lane area, which is our women's program. We have a large piece of land there that we're gonna build a outpatient and medical and intake sort of office building there. It's not necessarily going to house clients, but it will be a central hub for the community and our clients to get medical services. And we want to make it kind of like a community medical place where people can come to get those kind of services. We can do our intake processing much more efficiently, having those services on site instead of asking people who are maybe in an Arroyo to go get their medical records and blood work done, which is a challenge. And also our intake team and outpatient team would be housed there as well. It also works well for our women's program and the women and children, particularly. They have significant medical monitoring and needs that need to happen. And so they're just literally a walk across the parking lot to get to those medical services there. So that's what we're building, but then there's going to be a tremendous amount of construction on the other facility for the men's 30-day program.
Okay, that was helpful. Thank you.
I think, Councilwoman, I think Director Brown has his hand up and may have something to add.
Madam Chair, thank you. Good evening to the councilors and Council Villarreal. I just want to add some clarity to what Mr. Miller said. We have been in contact with Ms. Barella. She's not here tonight, but I wanted to just be clear from a Midtown development standpoint. We are not in any discussions or have had any discussions with the Recovery Center to go beyond their lease agreement. We've been talking to them for 18 months, but it was under our understanding that they would be building a new facility and moving away from the campus. So I just wanted to make sure that was clear. While we have not had any discussions with her about a permanent location, we have had many discussions with her about her exit strategy as we redevelop the land and rezone. And she has been clear to us that they are building a facility that would house their full contingent.
Thank you.
Understood. Thank you.
Misspoken, but
That's okay.
make an error.
You're right on. I mean, we are still in partnership with you all for a period of time.
When does the current lease end, if you don't mind me asking?
Madam Chair, Council Villarreal and Mr. Miller, I'm going to ask Sam to remark to that. I think it's the end of 2022, but Sam can speak to that because we have extended it 2 times. So.
Good evening, Madam Chair, Councilor. I believe we just extended it through April of 2022.
Mm-hmm.
Okay, Councilwoman Villarreal, you still have the floor, and then we have Councilor Cassett, and then we still have another agenda item to get to. So
Just one more question. I was wondering for your support services, how many folks are situated in Santa Fe that are here, or how many actually come from outside of the county? Do you know?
I don't know the exact number off the top of my head. It varies week to week, really. Sometimes we will have a lot of folks from the area coming through our detox. Other times we'll have more people coming from out of town, Albuquerque or Las Cruces, wherever. But it's hard to give a specific number to that in any given day. I'd have to pull up the census and go through everybody's where they're from.
I'm just curious what it was kind of anecdotally, but thank you for that.
I would estimate that we've doubled the size of our detox capacity by going with Wasala there. There's way more room. I would imagine that our people from the city will be coming much more often through the detox. We're just doubling the number of people there. So.
Okay, well, thank you for the information. That's all I have, Madam Chair.
Okay, Councilor Cassett, you're up next.
Thank you very much, Madam Chair. Thank you, Paul, for being here, and thank you for your presentation. I had a quick question. You mentioned that there's a women's and children program. Are there ever situations where single fathers come in and you're not able to house them with their kids, and what happens in those situations?
That's a great question. We have not had, well, we've had single fathers, I'm sure. They've not brought their children, and we don't have the same kind of grant funding program. That program is funded through a federal SAMHSA grant. I think it's a 5-year grant, and they fund and kind of direct that with some very specific guidelines. Unfortunately, there's not a lot of sort of guidelines, and that just simply doesn't happen that frequently. However, we do get men in our extended program who get pretty frustrated because they want to see their kids and they want to have that time with their kids too. So we make an effort to do that. It would be a new request to see if they were able to bring their kids. I think that would be something we would be open to if that came up. And frankly, maybe we need to ask that question more often. We may find it's frequent or happens more than you would think.
Yeah, I would be really interested to hear about that. I know traditionally we frequently think that kids are only ever with single mothers, and sometimes forget about the fact that single fathers who have sole custody of their kids exist too. So I absolutely would encourage you guys to start looking into that a little bit more, and maybe provide that feedback to your grantor, especially if you're able to gather some information. So thank you. I appreciate you being willing to explore that a bit more.
Yeah.
My other question had to do with your outpatient services. What's your capacity for how many individuals you're able to serve at any given time?
Well, each clinician could carry a caseload of 20 to 30. Right now we have 3 full-time clinicians. I would like to see that go up to 5 or 6 in a year. So whatever the math is on that, I'm not a math person, but so 5 to 6 people with 30 client caseload. Some of those people would be in IOP, so a lot of that work would happen through group, not necessarily individual. There'd be one individual, but a lot of that would be group time, like every 4 or 5 days a week there would be a group. So I think and honestly, that could grow until it doesn't, until we have all the clinicians have a full caseload and nobody's calling us to have services. I mean, we could have 10 clinicians or 20, I guess. And telehealth has really opened up a door that way. I mean, I think a lot of people dislike it. A lot of people really like it. And so having the option or the ability to do both lets us, see somebody in remote, outside of Gallup somewhere. And we also have services in Gallup, but we could see somebody in Gallup and be in Santa Fe or Albuquerque or wherever our outpatient office might be. But if we have a large collection of people in Albuquerque, we could open an office there and see people in person there. Just where the need or the client sort of demand we show up, we can do that. But sending people home and then just kind of losing contact with them is counter to what we're trying to do, and it may not be the best for them. We are in a process of tracking our outcomes and want to stay connected with our clients to find out, are they doing well? Do they need supports? What could we learn from their experience that we could do better going forward? So we're in a process of trying to gather that information as best we can. And that outpatient service is part of that too.
Yeah, thank you so much for sharing that. I look forward to you guys being able to expand, as I know that the need is very great. And thank you so much for your work. It's really important work. So we're very grateful to have you here.
Thank you. I appreciate it.
All right, we don't have any more questions from the committee. Thank you, Paul, for being here on short notice and filling in. It was great.
Have a great evening.
You have a good evening too. We will now go to the consent agenda. We are going to be talking about item A, the request for approval of a professional services contract in the total amount of $254,000 for a chart consultant team, Art Life LLC. We did do this last night at finance. So I'd like to just start with if the city attorney is available. I would like to have her just go over with us sort of the parameters of the lines of questioning that would be appropriate in the open session. And, if we want to go into executive session, that is something that could happen. I believe we have an executive session ability at governing body too. So Erin, if you wouldn't mind kind of helping us understand how the process works with regard to this item.
Sure. Thank you, Chairwoman Romero-Worth. Basically, if the contents of the proposals are the subject matter of conversation that is desired, or if there's lines of questioning that implicate the proposals, then we should go into executive session to discuss those. But the contract itself and the RFP process, the RFP criteria, and the evaluation process are all fine for public discussion. So the whole packet that was posted publicly should be fine. It's just the evaluation committee's analysis and the proposals themselves, which are confidential until final award, which is generally when the contract is approved and signed.
Okay, thank you. I think that's helpful. Councilor Garcia, I believe you pulled this item, and there may be others I think who have questions too. And we can decide as a committee what you'd like to do in terms of going into executive session with the group we have here tonight, doing that at the governing body meeting, or doing both. So Councilor Garcia, I'll give you the floor.
Thank you, Madam Chair. I do have some questions, I guess, pertaining to the process, and then I do have questions that would be more so directed at an executive session, and I guess we can chat about that a little later. But my first question, I guess it would be a request, is for all three proposals to be submitted to the governing body members with the scoring rubrics used on the proposals. It's my understanding that there's nothing in state procurement code that would prohibit us from receiving that information. So I would like for that to be sent to all of the governing body members. Last night, there was the names of the four folks that were part of the review committee. Two were city staff, two what I would call city affiliates. And I guess this is a question more so for Sam. Is there a reason why we didn't have any independent reviewers participate in this process?
Chairwoman, Counselor, I can actually not, I'm probably not the best person to speak to that because I did not select the members. Perhaps Director Kamiyama or the city clerk may have a little bit more information on that.
Okay.
Chairwoman Romero-Worth and Councilor Garcia. Yes, so when we were in discussion about who the reviewers would be, so we did select internally to the city as what we thought was the appropriate pathway. And so you have two qualified staff members from the city, the public Libraries Director Maria Tucker, and then also Julie Sanchez. Both have had experience working with community engagement and on different levels, as well as the procurement process and the standards. And then the advisory to the city was the Vice Chair Adelma Aurora Hasnako, who is with the Arts Commission and has been with us for years, also deeply into arts and culture, which Chart is very much into. And then for the city historian, we did ask around for other panelists. However, there was a conflict of interest for them. And our former city historian made really great sense because part of this will be sharing those cultural histories, and with his experience in that role for 2 years would be great insight. So that's how that panel formed.
Okay, I by no means am I trying to question the credentials of the membership. It's just through my experience, especially in dealing with state procurement process, there are independent reviewers that potentially can be wiped clear of any bias whatsoever. And when we have folks that are still tied to the city, there's still that potential for bias in that sense. And I'm very surprised that we didn't have any independent reviewers that were community members that are part of this process, as the state procurement process does allow for it. And I guess, was there a reason or justification that we didn't have community members participate in the RFP review process?
Chair Romero Worth, Councilor Garcia, we did reach out to some, but again, there was some conflict of interest. And so we felt that the panel that we selected would be able to review and evaluate based on the procurement criteria, and to do so with open mind and being unbiased.
Okay. I find it hard to believe we couldn't find 2 folks throughout the city of Santa Fe to participate in this review process. I know that this is a topic that folks have been looking forward to for over a year now. And to me, I think that's a little hard to believe that we couldn't find at least at minimum 2 individuals from the community to participate in the review of this. I guess my next question. So last night, the applicants provided an introduction to themselves and had an opportunity for questions. Is that what we are considering, an opportunity for clarification?
I'm sorry, Counselor, an opportunity for clarification, not clear on your question.
So throughout procurement processes, when there are proposals submitted, usually through a RFP, there is what is called a clarification process, where an applicant submits their packet of information, and then there is an opportunity for clarification. The internal reviewing team has that opportunity to reach out to the applicant and to say, hey, you talked about this, and we want to get additional information just to ensure we're fully grasping that. And so my question is the opportunity that was presented last night, and I'm assuming throughout the remainder of this process, is that what we're considering the clarification process?
I don't think so. I will defer to the city attorney.
Councilwoman Romero Worth and Councilor Garcia, as you mentioned, that process is by the selection committee, and the committees are not the selection committee, and the governing body is not the selection committee. So that process occurred earlier.
Okay. And so I guess my concern is that we're only allowing the opportunity for one proposal submitter to have questions asked to them by the governing body.
But Counselor, and again, I'll defer either to Sam or to Aaron. They are the recommended proposal from the selection committee, and that is why they are the ones we are currently evaluating whether to accept the recommendation of that evaluation committee and award this group with the contract. That's what's being considered. The process was already completed by the evaluation committee. And Aaron, correct me if I'm wrong.
No, I understand the process. Thank you for clarifying, Chairwoman. But in my history of dealing with state procurement process, there is the review body. Then the review body makes the recommendation to the approval body. In my experience, and this goes years. I mean, I have never seen a proposal submitter go in front of the body that's ultimately going to select and have the opportunity to ask questions. And that to me is a very brand new process. And I want to make sure that we are giving fair due process to all proposal submitters, whether they're the selected or not. And I think that's where, as I've mentioned, I've dealt with state procurement process where things are scored and it is what it is. We didn't have the opportunity to ask an applicant further clarifying questions because that could ultimately reflect on a score that was previously, I guess, set in stone by the review group. And I'm just trying to fully understand why one group is allowed to speak and ask questions or have questions asked to them, whereas the full panel, I guess I would just say the three folks that submitted have that same opportunity. Whether I understand it's the recommended, but again, I want to fully understand that procurement process. So maybe that's a question for Erin.
Yeah, Erin has her hand up. I'll let her answer.
Chairwoman Romero-Worth, Councilor Garcia, these questions cannot be used to score the applicant. The scoring is over.
I understand that, but we're making the decision. And so with that being said, then there shouldn't be the opportunity to ask questions of the proposal submitter. It's in that sense. I'm just trying to wrap my head around because this is a new concept that I've never seen in the state procurement process in my dealing with state procurement process.
Aaron, do you want to?
Chairwoman Romero-Worth, it's certainly not a required step. I think it was an interest to introduce the recommended party to the community.
But there was also opportunity for questions to be presented to the body last night, to the proposal submitters in the committee.
Actually, Counselor, that was not the opportunity that I gave the recommended awardee. I asked them only to because it was a public meeting and we were not in executive session. I asked them to introduce themselves, to talk about their background. And that was the limited layer that, we could ask them, how many years did you live in Santa Fe? Or how many years have you been a consultant, or that kind of thing. But it was only an introduction and about background and who they were.
Right. Okay. Thank you for that clarification. And still in that sense, I've never seen that part of the process. And so I'm just trying to wrap my head around how that flows with the state procurement process.
And Chairwoman Romero-Worth and Councilor Garcia, we did this exact same thing with the Midtown team last summer.
Okay. Thank you for that. And we did have the opportunity to ask questions to the Midtown team, did we not?
I think only as to background, we didn't get into their proposal specifically without getting into executive session.
Yeah, Madam Chair, if I could.
Director Brown is raising his hand.
Yes, thank you. Madam Chair and Councilor Garcia, Ms. McSherry is correct. The Midtown development team was there just to introduce themselves because it was a very large project and we wanted to let the public know and the councilors know who they were as we went through the process, as we went through the E&A process. So there were no specific questions about their capabilities or things of that nature. It was really an introduction of the team that was on the call, just like we're doing here, where we wanted to make sure that through this process that this recommended firm is available to just introduce themselves, because this is a very important procurement that we're about to make.
Okay. Thank you so much, Mr. Brown. I appreciate the clarification. I don't have any other immediate questions. I just want to confirm that all of the 3 proposals with the scores, I'm assuming with the 2 that made it to the scoring process, can be shared with the governing body.
I will defer to Aaron again.
Chairwoman Romero-Worth, that should be fine. I know that the evaluation memo was already shared, and it would be fine for the proposals and the score sheet to be shared as well.
Okay, thank you so much. I really appreciate that. No other questions, Madam Chair. I do have questions for an executive session should we, as a committee, decide to go that route tonight. With that, I'll go ahead and yield the floor.
Thank you, Councilor. Are there other questions from the committee?
Madam Chair.
Councilor Rivera.
Yeah, are we going to get a chance to hear from Artful Life I guess like they did last night, introduction and some questions regarding background?
Absolutely, absolutely. I believe Valerie Martinez is here with Artful Life. Hi, thank you for joining us again tonight. I think similar to last night, second chance, slightly different group. So, some of us were with you last night, and we've added on a couple new counselors. So this would be a great time to again introduce yourselves to the Quality of Life Committee and talk a little bit about your background and who you are. Thank you.
Thank you so much. I just want to apologize that Janice Garab, my co-director, is on an airplane right now, so she can't join us tonight. But she sends her apologies and her regards. Thank you, Madam Chair and members of the Quality of Life Committee. My name is Valerie Martinez, and I'm the founding director of Artful Life, and we are honored to be the recommended awardee for the CHART project. A little bit about me. I was born and raised in Santa Fe. I went to Salazar Elementary School, De Vargas Junior High, and Santa Fe High. My father, Jose Ramon Martinez, and my mother, Exilda Martinez, taught many generations of Santa Feans. My dad is a Santa Fe High math teacher and tennis coach. My mother as a teacher and principal at Alameda Middle School. I am a poet, an educator, an arts administrator, a community engagement consultant, and a collaborative artist. It was my honor to be your Santa Fe Poet Laureate from 2008 to 2010. My professional career includes 23 years in academia, including 4 years teaching at New Mexico Highlands University. I finished my academic career with 6 years at the College of Santa Fe before it closed in 2009. In 2007, I entered the field of arts and community development with Little Globe, which is based here in Santa Fe. And I was part of the artist team and or a director of large community projects like Memory Lines, Voces de Nuestras Jornadas, the Santa Fe Bus Opera. And as poet laureate, I worked with 3 and 4 generations of 11 Santa Fe families to create poetry and art as part of the Lines and Circles project. Some of you may have attended the opening of that show in March of 2010 with over 400 Santa Feans. It was a really beautiful gathering. I formed Artful Life in 2015 to continue and evolve the work of knitting together communities, especially diverse communities, through creative and arts engagement. I know, because I've witnessed it, the power of the arts to create what I call connective tissue and meaningful relationships between people who are different, and often in communities that are struggling with crisis and division. And I think that's all I'll say for now, unless you have any questions. Thank you for having me.
Thank you. Councilor Rivera, did you have particular
Yes,
questions?
Yeah, just one. Thank you, Madam Chair. Thank you, Ms. Martinez, for being with us this evening. I was just curious as to what your role was in the Fiesta Council deciding to do away with the entrada. Can you describe what your role was?
Yes, so I was invited by the Santa Fe Arts Commission at that time to work with a group of writers. The decision had already been made by the groups that talked together for over a year. So they had already made the decision. And I was part of a group of writers who wrote the proclamation. So what we did was study a year of notes from those conversations and gatherings so that we would make sure that the proclamation contained language that was true to the process and true to the decision that they made together after a long time. And so as a writer, I was charged in collaboration with the others of writing something that expressed the spirit, the complexity, and the will of that group who made that decision.
Okay, and it looks like most of the work you've done involves art or some type of art. Have you ever done a project such as this that may not, or maybe it will, I don't know, but doesn't look like it's going to revolve around art or art projects?
Well, I've done a lot of work with what's called art activations in the RFP, but I've also done quite a bit of work as a consultant in terms of community engagement. I did work with the city of Santa Fe as part of the Midtown project several years ago to create a facilitation team and train them to conduct some public meetings for that. So my experience is with art projects, but also very deep in community engagement. And so that's what I bring to the project.
Very good. Thank you. Thank you, Madam Chair.
Thank you, Councilor. Are there other questions from the committee? All right, what are the wishes of the committee? Do you want to go into executive session tonight? Do you want to wait for governing body when we're all together to go into executive session? What's the pleasure of the committee? If there are questions to the proposal itself that we cannot discuss in an open public meeting.
Madam Chair?
Yes, Councilor.
I have some questions that would be more warranted for an executive session. And I think it'd be helpful to do that tonight.
Okay. So there's a process for this. Do you want to make that motion?
Yeah, if
I can make it for you and you can say so moved.
That would be helpful because I don't have it.
All right. And then just a logistical question, how would we do that? Will we use this channel? Will we go to a new link? Our city clerk is with us.
Yes, Madam Chair, we will go to a different meeting that was set up. So Jennifer would stay with this line open, and then I will send you a separate Zoom link specific to executive session. And then we will leave this meeting and go to the others, similar to the way we handle governing body executive session. So if the motion is approved and it's the desire of this committee, then I will email you the link that is set up for the executive session.
Okay, and just to be clear, who would be in the executive session? So our Jennifer would stay here in this meeting, and then everybody else that's currently a panelist is going to move over?
Correct.
Okay.
And Chairwoman Romero-Worth, I would just want to remind folks we would need to come back as
Yes,
well.
yes, of course. All right, so here we are. So this is the motion. That the Quality of Life Committee will enter an executive session pursuant to the Open Meetings Act, Section 10-15-1H, Subpart 6, for discussion of a competitive sealed proposal solicited pursuant to the City Santa Fe Procurement Code. That is the motion.
So moved.
Is there a second?
Second.
All right, if we could have a roll call on the motion, Jennifer.
Counselor Jamie Cassett, Counselor Michael Garcia,
Yes.
Counselor Chris Rivera,
Yes.
Councilwoman Renee Villarreal,
Yes.
and Chair Carol Romero.
Yes. All right, so the Quality of Life Committee is going to move into executive session. We will return to bring us out of executive session, similar to the way we work at governing body meetings. And with that, we will leave this meeting and a link will be sent to join the new meeting. We'll see you in a minute. Do we have Jennifer back?
Yeah, I'm here. I just changed my name.
Ah, gotcha. All right, let's see. Do we have all the, no, we're missing, no, we do. We have everybody, yeah? All right. I am going to, let's see. Because I have the sheet, I will make the motion, and if I will state the motion, and then if somebody can say so moved, I think that's the best way to go here. Pursuant to the Open Meetings Act, Section 10-15-1J, the Quality of Life Committee, well, somebody on the Quality of Life Committee moves that the that the Quality of Life Committee reconvene an open session and state for the record that the matters discussed in the closed session were limited to those specified in the motion for closure.
So moved.
Second.
Second.
All right, so Councilor Rivera made the motion to move us out of executive session. Councilor Cassett made the second on that motion, and if we could get a roll call, please, Jennifer.
Councilor Michael Garcia,
Yes.
Councilor Chris Rivera,
Yes.
Councilwoman Renee Villarreal,
Yes.
Councilor Jamie Cassett,
Yes.
Chair Carol Romero Worth.
Yes. So I believe I need to know what the wishes of the committee are with regard to this item. If we're finished discussing it, or if somebody wants to make a motion, we can continue to discuss it.
Move for approval.
Second.
Right, we have a motion to approve this item from Councilor Rivera and a second from Councilor Cassett. And is there further discussion on this item tonight? Seeing none, can we take a vote, please, Jennifer?
Councilor Chris Rivera,
Yes.
Councilwoman Renee Villarreal,
Yes.
Councilor Jamie Cassett,
Yes.
Councilor Michael Garcia,
I'm going to abstain at the moment.
and Chair Carol Romero Worth.
Yes. All right, we have no action items for discussion tonight. Are there matters from staff?
No matters from staff tonight, Madam Chair.
All right, are there matters from the committee? Matters from the chair. Our next meeting is Wednesday, July 21st. Thank you all for your time tonight, and we will see you at the next meeting. Good night, everyone. We're adjourned.